Hello and welcome to your Harrisburg Community College Blended Learning EMR program. James Weber here to give you a little bit of a rundown on the important portions of the toxicology chapter of your book. Toxicology. Toxicology really deals with the matter of poisonings, being poisoned, taking, drinking, eating things you shouldn't that make you sick, right? Poison is a substance that causes illness or death when eaten, drunk, inhaled, injected, absorbed in even relatively small quantities, right? EMR can save patients' lives really quickly by recognizing and promptly seriously treating these life-threatening conditions and poisonings. Patient assessment for poisoning is kind of one of the most important key points, right? Poisoning can be classified in the way that it enters the body versus ingestion versus inhalation, right? Ingestion is one way where it actually enters the body through the mouth and absorbed through the digestive system, right? Inhalation, on the other hand, we breathe it in, right? In through the nose, absorbed by the mucous membranes and the lining of the respiratory system, right? A couple different ways we actually get an actual poison into us. Injection, that's another way. Poison spreads through a small opening in the skin and spreads right into the circulatory system. And absorption, right? That poison enters through intact skin and spreads through the actual circulatory system itself. The scene size up and the primary assessment and the history taking and the secondary assessment and the reassessment, you'll see this kind of recurrently come back to us in each one of the chapters moving forward, because that is the framework for the assessment from top to bottom we learned in a previous chapter, right? So if this looks familiar, not only are you going to see this here, but you're totally going to see this repetitively over and over again. Scene size up, right? General assessment and treatment. Follow the patient assessment sequence. Make sure you get a really good history for bystanders, right? Because your overdose patient might not be conscious or might be acting funny, talking funny, right? We want to question not just the patient, but consider the fact that bystanders might be the best clues as to what's going on with that patient. Be alert for visual cues as well that may indicate poisoning, right? And just keep in mind, a lot of that emergency care depends on the patient's signs and symptoms, right? Depends on the patient's signs and symptoms. Table 11.1 talks a lot about general signs of symptoms of poisoning. History, respiratory, digestive, central nervous system, just different symptoms you might see for a patient who has injected, absorbed something that can really do them some harm, right? We need to be on the lookout for these kinds of symptoms and a patient presentation that gives you the indication there might be some sort of poisoning that has occurred. Ingested poisons. More than 80% of all cases of poisonings are caused by ingestion, right? Chemical burns, odors, stains may be found around the patient's mouth. Signs and symptoms: nausea, vomiting, abdominal pain, all indications of ingested poisons, and can be pretty significant in nature depending on how bad that poison is. Signs and symptoms: diarrhea, abnormal and decreased respirations, of course, loss of consciousness, seizures, all examples of ingested poisons. Biggest thing is going to be identify that poison, and more often than not, you're going to want to make sure that whatever the container of the poison that person took or ingested or accidentally ingested, we need to successfully identify that and make sure that makes it off to the hospital, right? If you got the time as an EMR, calling the National Poison Center for instructions is a good idea, right? Because they'll be able to give you a little bit of guidance on what you're supposed to do in that circumstance. If you're unable to contact the poison center, dilute any poison by giving water, right? Dilute with water really is it's kind of a winning strategy for the great majority of the poisons in which a patient can come in contact with. Activated charcoal, it is a medication that's available. Doesn't fall within the EMR scope per se. In Pennsylvania at least, but it does fall within the national scope, which is the reason why we got to talk about it. Activated charcoal, finely ground powder, it's mixed with water. The activation or the purpose of the charcoal is actually just to bind with the actual poison itself, right? So that the body doesn't absorb the poison. It actually stops the body from absorbing the poison by binding to it, right? And then, of course, the body getting rid of it in the traditional way they normally would. It does have some contraindications. Don't give it to the patient if they've ingested an acid or an alkali, if they've ingested a base, or if they're unconscious, right? Or if they're unconscious. Usual dose is 25 to 50 grams for an adult, 12 to 25 grams for a pediatric patient. Serve it in a covered cup and give it to a patient with a straw. I will tell you, it tastes terrible, right? I say this as somebody who's given it a number of times. It really tastes terrible for your patients. Sometimes it can actually bring up vomit. Sometimes they can see at least them dry heaving and trying to keep that activated charcoal down. Encourage them to do the best they can at actually getting it down. Because it's really going to be helpful at making sure that they don't actually, absorb a lot of that poison from what they ingested. Don't do anything to induce vomiting. Why? Well, while it seems like a good idea, right, to vomit that stuff out, the problem is when you induce vomiting, right, that vomiting can create a lethal airway obstruction, right? All that vomit being in that airway can actually, we could actually create a lethal airway obstruction. So we don't want to induce vomiting. Right? You may hear from other EMS providers that have been around a while, some other things that Epicac, right? Epicac is a thing that we could give, make people throw up, and it's great. We haven't used Epicac across the country for a long time, right? It's no longer endorsed by the poison control centers. For children or adults for poisoning because it creates a really dangerous circumstance with their airway. So it's important that we make sure that we're utilizing that activated charcoal when it's available to us because it's definitely more effective and safer than Epicac. Inhaled poisons. It occurs if a toxic substance is breathed in and absorbed through the lungs. Toxic substances, carbon monoxide, for example, they're not irritating. Carbon monoxide, you may not even know that you're breathing it in, right? But it can be pretty extraordinarily toxic to a patient. Other toxic gases, chlorine gas, ammonia, very irritating to the respiratory tract as well. Signs and symptoms: respiratory distress, dizziness, cough, headache, hoarseness, confusion, or chest pain. Carbon monoxide, common causes carbon monoxide poisoning, improperly ventilated heating appliances, or smoke. Signs and symptoms: headache, nausea, disorientation, unconsciousness, flu-like symptoms. The flu-like symptoms is pretty rare by comparison to the nausea, disorientation, and eventual unconsciousness, which is remarkably more common. Biggest thing is going to be if you find a bunch of people, especially in a house, especially in the beginning of winter, a bunch of people who all report those symptoms, get everybody outside at all times. The biggest carbon monoxide poisoning of a large scale that I had was about 75 patients who were all vomiting and very sick, and all of their symptoms went away about 10 minutes after I pulled them out of what was a shopping mall, actually the food court or shopping mall. If you find a lot of people with the same symptoms, have them all go outside, because more often than not, it's environmental. And now, some of the treatment for inhaled poisons: remove the patient from the source of the gas. If they're not breathing, start mouth-to-mask breathing. If the patient is breathing, really going to want to bury them with tons and tons of oxygen, right? That's super important. Really start heading towards the hospital or arranging for that prompt transport as quick as you can, and just keep in mind you might have to evacuate people first. Injected poisons. Two of the major causes of poisoning by injection are toxic injection, purposeful or otherwise, or animal bites and stings. Obvious signs and symptoms, things like obvious injury site, right? You might see the redness, you might see the sting marks, you might see the bite marks, tenderness, swelling, red streaks radiating from the injection site, weakness, dizziness, localized pain, itching. Keep the patient calm and still whenever that's possible, though sometimes that's hard. Wash the site with soap and water. Remove the stinger when you can using gauze wiped over your area with a fingernail. Apply ice packs to reduce swelling when it's appropriate. And keep in mind, patients might experience some extreme allergic reactions and go into anaphylactic shock. Signs and symptoms of anaphylaxis are important to know because patients who don't get quick identification of anaphylactic shock with acute fast care are patients who get very sick very quickly and sometimes don't survive. So, signs and symptoms of anaphylaxis: itching, hives, swelling, wheezing, generalized respiratory distress, generalized weakness, right, as well as loss of consciousness. Signs and symptoms of anaphylaxis include things like rapid and weak pulse, rapid shallow breathing, hypovolemic shock. Treatment for anaphylaxis, of course, biggest things can be maintain those ABCs, right? Administer oxygen whenever you can and treat for shock. Treatment for anaphylactic shock include removing the allergen if possible, monitoring patient's vital signs. If the patient condition progresses to the point of respiratory or cardiac arrest, begin mouth-to-mouth breathing or CPR and immediately arrange for rapid transport. If the patient has prescribed an auto-injector, help the patient use it. Place the tip of the auto-injector against the outer thigh. Push the auto-injector firmly against the thigh and hold it for several seconds. This is a skill in which we will go over during your final weekend lab session. 4 kinds of venomous snakes in the U.S. There's a couple of examples there. Snake injects the poison into a person's skin and muscle with its fangs. Signs and symptoms of a snake bite. Uncommon, but it does happen. Pain, swelling, fainting, sweating, nausea, vomiting, as well as shock. The bite of a coral snake delivers slightly different poison. You might have things like respiratory difficulties, slurred speech, process, coma, and seizures, because it deals more with the neurological system of the body than anything else. Treatment for a snake bite, biggest thing is going to be keep them calm and still. Sometimes difficult because, well, they just got bit by a snake. But have the patient lie down and try to relax as best they can. Wash the bite area with soap and water. If the bite occurred on the arm or the leg, split the affected extremity. Reduce the movement of the affected extremity wherever you can. Treat the patient very carefully and arrange prompt transport, but be mindful of what we mean by prompt transport, because the patient should really be going to a hospital that we know for certain contains the correct antivenom. Absorbed poisons occurs when the poisonous substance enters the body through the skin. Common poisons, insecticides, toxic industrial chemicals. Signs and symptoms: traces of powder or liquid on the skin, inflammation or redness to the skin. Signs and symptoms: chemical burn, skin rash, burning, itching, nausea, vomiting, dizziness, shock. All signs and symptoms of a patient who has had a poisoning that has been absorbed through the skin. Treatment for absorbed poisons: ensure the patient is no longer in contact with toxic substance. Brush, do not wash dry chemical off of the patient. Contact with water may activate the dry chemical and result in a burning reaction. Wash the patient completely for at least 20 minutes. If additional EMS personnel are delayed, contact the Poison Control Center or your medical director for additional treatment. If the patient's experiencing shock, have the patient lie down and elevate the legs. And if the patient's having difficulty breathing, administer oxygen. Treatment for nerve agents, of course, assess and support ABCs. Be mindful that there are nerve agent antidote kits out there that contain 2 different auto-injections or sometimes combined for 2 medications to be able to address a nerve agent poisoning. It's just an example of how to actually administer that. That's not part of your testing process, but the actual auto-injector for a Duodot kit is no different than the auto-injector that we're going to train with for epinephrine. So when you get that training for epinephrine, just be mindful of the fact that the use of a Duodot injector is basically the exact same. You just have to use it for a different reason than the anaphylactic shock for an EpiPen. Such treatment for nerve agent exposures. Substance abuse. According to the National Survey on Drug Use, 8% of the population have a substance abuse disorder or dependent on alcoholic drugs at any given point. That goes higher or lower depending on the year. Substance abuse results in increased illnesses and injuries, right? Even if it's a primary reason for the cause, not substance abuse, it really can be a contributing factor. Alcohol. Alcohol is the most commonly abused drug today. It's involved in a lot of crashes, a lot of murders, a lot of suicides. The symptom of intoxication is similar to other medical illnesses, like stroke, the confused part of a seizure, towards the tail end of a seizure when you're beginning to recover, right? Called the post-ictal phase. You'll remember this from your neurology section. That phase, that post-ictal phase, can sometimes mimic intoxication. So can a stroke, so can diabetes, right? All of these things are very similar. Be very careful in your examination to make sure that you're clear on what's going on with that patient. Alcohol is an addictive depressant. People dependent on alcohol can develop some pretty severe withdrawal symptoms, right? As much as it occurs because they decided to drink at some point, the symptomology itself is no joke. Delirium tremens, DTs, can be physically painful, can be life-threatening. It's important that we're really, really understanding and show empathy to these kinds of patients. Shaking and restlessness are just 2 examples. Other examples: confusion, lethargy, right? We can see patients who are having hallucinations, GI distress, chest pain, fever. It can absolutely be a serious medical emergency, and I will tell you, not only can it be fatal, but I've personally, as a provider, seen it be fatal. It 100% can be a fatal medical emergency. Drugs. Drugs may be ingested, injected, absorbed. Look for clues to indicate the way the drug was administered. Abuse of prescription drugs have increased in recent years, and we need to just be aware of that. Amphetamines, they stimulate the central nervous system. Speed, ice, crystal meth, cocaine. These are just some examples of amphetamines, right? Amphetamine use develops restlessness, irritability, talkativeness, right? Keep a patient from harming themselves, transport them to a facility. Your biggest goal is going to be monitor and manage the vital signs, keep the patient from hurting themselves, and make sure you get them to a hospital that can manage that overdose. Pain relievers, opioids, and heroin. I'm sure you've heard of the opiate epidemic in the United States in probably the past 3 or 4 years, although truly it's been going on the past 25 or 30 years. Pain relievers and heroin. This really started as a problem with prescription drugs, right? Things like Vicodin, Oxycontin, morphine, and codeine. Signs and symptoms of opiate overdose: slow, difficult, shallow breathing or no breathing, small or pinpoint pupils, weak pulse, low blood pressure, bluest nails and lips, drowsiness and disorientation, delirium, and a coma. Narcan is something that can reverse the effects of opiate drugs in the central nervous system. It is available for intranasal administration of an autoinjection. This is one of the drugs that you can give to a patient as an EMR. You've got protocols for it in the state of Pennsylvania, and it is part of the National Registry Drug List and part of the EMS education standards. Narcan. EMRs can give this medicine if they're trained on its use, and part of your training is that, and the organization that you have or that you eventually work with or work for has medical director approval to be able to administer this program. So be mindful of the fact that it does come with rules, but it is part of your scope of practice. Hallucinogens, things like PCP, LSD, peyote, mescaline, and mushrooms. Chemicals that cause people to see things that are not there, right? These are drug overdoses where people begin to hallucinate. Signs and symptoms: convulsions, coma, heart and lung failure, as well as stroke. Just some examples. Wherever you can, try to reduce the auditory and visual stimulation, right? Because the more auditory and visual stimulation, the busier the room, the more people that are talking, the more difficulty your patient's going to have in trying to actually communicate with you. Approach every scene with caution and arrange for transport wherever you can. Abused inhalants, right? Intentional inhalation of volatile chemicals. Many of these substances can be bought in hardware stores. Many cause drowsiness, unresponsiveness, seizures, and sudden cardiac death. Try to keep the patient calm and still wherever you can. Support the patient's ABCs. Give high flow oxygen. Carefully monitor the patient's vital signs and arrange for prompt transport wherever possible. Toxic injection from drugs. Patient's reaction depends on the quantity and the type of drug, so it can really vary for toxic drug injections. But things like weakness, dizziness, fever, chills are really good examples of symptoms that you might come across. Biggest thing is going to be support the patient, treat the symptoms, right? Arrange for transport, and check the infection site for redness, swelling, and increased temperature for indications of infection. General treatment for a drug overdose: provide basic life support, keep the patient from hurting themselves or others, provide reassurance and emotional support, arrange for prompt transport, administer Narcan or naloxone if you've been properly trained or authorized, and avoid classifying or judging the patient, because part of that empathy discussion that we had previously, it's important not to overjudge or not to overclassify or judge this patient. A quick summary, of course: 4 primary routes of how a poison gets into the body: ingestion, inhalation, injection, or absorption. And that you're definitely probably going to maybe see questions about routes into the body in your test for this particular chapter and section. An ingested poison is taken by mouth. An inhaled poison is breathed in and absorbed through the lungs. 2 major causes of poisonings by injection are animal bites and stings, and toxic injection. Poisoning by absorption occurs when a poisonous substance enters the body through the skin. Many nerve agents are the same types of chemicals as insecticides. Your role in incidents involving nerve agents is to keep yourself and others from becoming exposed. Pay specifically special attention to scene safety, and don't enter a scene that you're concerned about, especially one with a hazardous environment, without the proper training and equipment. So this kind of concludes our discussion on toxicology. This is just a loose overview of some of the content you'll find in your book. Make sure you use all the resources that are available to you on D2L. If you have questions, reach out to your coordinator. And as always, thanks for your time, your energy, and your patience, and we look forward to seeing you at our next lesson. Have a great day.